I'm joined by Dr. Anilkumar Nayak, Secretary General at Indian Medical Association. Thank you, Doctor, for joining with us.
Thank you, madam.
The Indian Medical Association has written to Union Health Minister regarding postponement of NEET PG 2023. Why did you send the letter to the minister regarding NEET?
Madam, as you know, there are more than 8,000 students are unable to attend the NEET PG examination from the various states of the India. And second, the most important thing, because we have extended the qualifying criteria from June to August. Now they have also increased in yesterday's letter. Their qualifying date is late up to the August. So many students didn't get the time for preparation of the NEET PG examination because they have to attend all the compulsory internship, means rotatory housemanship. So students cannot read properly. They have not got the proper time to give the examination. So many of the students from various associations requested us, kindly request our health minister that if they can postpone, because previously, since last 2 to 3 years, the admission process and counseling will start in the month of the August. So if you take an exam on 5th March, there will be a 5 months gap after giving the examination. So they have requested if they postpone for 1 or 2 months or 2 or 3 months, then they will, government have no problem because their counseling process will start in the month of August. So they have enough time. We have also enough time. And this is the multiple choice question type examination on the computer. So the result preparation will be easy for all of us. So we have requested in the favor of the students, for the benefits of the students, if you can postpone the examination for 2 to 3 months, that is best. That is why myself, Dr. Anil Nayak, and our president, Dr. Saradal Agrawal, have requested and write a letter to government of India and our Honorable Health Minister, Sri Mansukh Mandaviya, if you can postpone the examination, that will be good for the students.
So what was the minister's response to the letter?
At present, we have not got any response, but we think because government is only minister will have to ask the statutory bodies like NMC and National Board of Examination, are they able to take examination after 1 or 2 months and everything. Though they will discuss with their bureaucrats and they will later on finally they will declare it, because by 5th March we have enough time. So they may take decision in next week or in fortnightly.
Okay. So on January 13, the Union Health Ministry extended MBBS internship cutoff date to June 30th. However,
Yes.
it has not yet
Yes.
postponed. Yeah. However, it has not yet postponed the entrance exam date. What can be the major reason behind this?
Yes. That I don't know, because it's a technical issue and government is a other body and examination process will be taken by the National Board of Examination. So both are the separate body. So they may discuss with the National Board of Examination, and permission of National Medical Commission is also required, because they are going to start the counseling process and admission process for NEET after passing NEET PG all over India, because there is a all India quota also for state have their duties. So they may discuss with all the bodies, and then they will take the decision. So government is in process of thinking, and as you know, budget session is in progress. So minister might be busy because they have to attend the budget session in Rajya Sabha and Parliament also. So they might be busy. They have, if they have got time, enough time, they will discuss with their bureaucrats, and they will take, he will take the decisions.
Okay. So the NEET PG aspirants protested at Jantar Mantar regarding the postponement of the examination. What are the major demands of the aspirants?
Major demands, basically, they want to postpone the examination for 2 to 3 months. That is the main demands. But main though our demand is to help them only because the student are our young generation. They are in future they are going to become a member of our medical association. So we have to help our new generation, our future generation, because they are going to be a member of Indian Medical Association after passing MBS and after joining this post-graduation course, because we have to also being medical student network and junior doctor networks. So both are the our wings. So if they ask us to help as a mother institute Indian Medical Association, we are supposed to help them.
Okay, so in 2022, also the aspirant had demanded postponement of NEET PG examination as it was clashing with NEET PG 2021 counseling. So is scheduling of NEET PG examination a continuous issue? Why is this issue not yet resolved?
Madam, as you know, since the COVID pandemic from 2019, lockdown and everything, and the various emergencies into a type of this burst of the COVID, all the resident doctors, junior doctors were busy. The government and everybody is not able to in position to give the examination of NEET and everything. Routine examination all had also postponed. So there was a problem due to COVID, and in all over world, many countries have such type of problems. So they are by day or 1 or 2 year it will take to regularize the examination. It is only because of the COVID pandemic. Because we are the students, we have to work in hospital also, and after working hours, we have to give the examination also. So all the exam schedule and everything postponed because of the COVID. Fortunately, because of our Prime Minister handled COVID pandemic very well, we are now out of danger. That's why we now in coming years it will be 1 or 2 year it will be adjusted by all the people, by the government and by students also. This happened because of COVID only, because not of because of the government or because of the students union or because of the university. It is only because of COVID-19.
So according to you, will it take 1 to 2 years to resolve this issue?
Yes, it will take, madam, because day by day we have to reduce our spread. Now you can take an exam in August, then in July, then in June. So it will be regular or decrease the gap by 2 months. So in 2 years, it will be adjusted by the government if they wishes.
Okay. So for this 2 years or before, the students are confused with the timeline of the examination. How is this
Yes, madam.
issue? Yeah. How is this
Yes,
issue
yes.
affecting the overall preparation of NEET aspirants?
People and students preparation will affect them. That is right thing. But people are worried about because this is a NEET PG examination. National Medical Commission is also going to start a next examination for all over the India instead of this NEET PG. So they are also in confusion if next year next will come, because they have started next one and next two instead of this NEET examination. So they are also operating. If we will not give NEET, then the next will come. Next there are two type of tests. They will also include practical and theory both. So there is a lot of confusion, lot of stress among the students, because next is when it will be start, that is not declared by the government or by the NMC. So they are very much in confusion mode, turmoil mode. So if we will not give NEET this year, then next year next will come, next examination will come. That is why they are in very much tension and very much stress.
Okay. So the doctors are planning to take legal action on this matter. What will be the contentions before the court?
I don't think legal action will help us, because it is a process by pursuing matter to the government, and they have to take the they consider the feeling of the students and by compassion and emotional involvement, they can take the decision. Legally, we cannot go because legally, I don't think, and it will take a long process because we have to ask for extension of the examination for 1 or 2 months. And legal process will continue for 2 to 3 years. It's a long process. As you know, many cases are pending in Supreme Court and High Courts, various High Courts. So legal process is too long process and it will take long time. So we don't prefer to go to the legal.
Okay. Okay. Thank you, doctor, for joining us. Thank you for sharing your perspective.
Thank you, madam.
Thank
Thank you,
you.
madam. Thank you very much.
Thank you.